Hi, everyone. Thanks for watching. We're going to be answering the question today, how many hours a day should someone wear a back brace? And we're going to give you some different scenarios because we need to try to answer that in a relative way, okay? I'm just going to tell you that a lot of our patients, I've been doing this a long while now, almost 2 decades, that we see a lot of patients in the hospital. If they have a back brace, it's usually for a serious injury. Having said that, most of those patients do not wear that when they lay down, okay? So if you're a person that sleeps 8 hours a day, you don't have to wear it most of the time I've ever seen it, people don't wear them when they lay down. What I find usually happens is someone, when they sit or stand, it is time to be putting on that back brace. When there's more stress on the back, and gravity comes more into play that way too. So there's more pressure on the spine and needs to be supported. Now, if you want to just do it cut and dry where someone sleeps 8 hours a day, okay, so that's out of there. And now they're going to wear the brace because they're going to be sitting or standing for the rest of the day. You can do the math there. Now you might go back and lay down for an hour, etc. But you might not be laying down ever for the rest of the day. So if you are not, so it would be another 16 hours basically that you would be wearing a TLSO brace for, or a back brace, okay? That is if you do not lay down again. These are general rules of thumb. Everyone's injury is different. Everyone's reason for wearing a back brace is different, okay? Some people just wear them for comfort. That is a relative term. So if someone is going to be doing stressful activity, that's a whole different ballgame. The question then comes up is, does a back brace make my back weaker? And it definitely doesn't make it stronger. It does make it more supported, okay? But it can do a lot of the work. And you don't want to be in a TLSO or a back brace for the rest of your life if you can really help that. It's a temporary measure. That's what we tell people a lot, to restrict some movement of the spine in order to promote healing. So that's something to look at as well. But in terms of the strict hours per day, if anyone ever gives you a perfect example of how many hours a day that you should wear your back brace or your TLSO, you should probably run, if you can, from that person. It all depends on how you look at it. If you sleep 8 hours a day, usually, I can tell you this for certain, usually those people do not wear those braces when they've been laying down. I've had a couple people wear them when they lay down because they felt like it took all their pain away and they could fall asleep because they had it on. So as you can see, there's different ways to approach this, but nobody knows exactly how many hours a day, especially down to the minute, that you should be wearing it. I can tell you, usually though, it's when somebody sits or stands that they have to have it on, and I personally recommend applying the brace when you are laying down in order to then get up for the rest of the day. That's personally my recommendation for my patients. Do it that way because you get the best grip on someone's spine in that way. Their circumferences around their iliac crest, basically in their belly section, are their smallest, okay? If you put a brace on when somebody sits or stands, those circumferences are much larger, okay? So if you sit, stand, or lay down and you kind of move around, those circumferences change and now the brace can move around. I would ask your orthotist on that. Hopefully you got your brace from an orthotist, to be really honest. But I hope that information helps you. Good luck.